Good afternoon, everyone. We want to welcome you to our webinar workshop this beautiful Thursday afternoon. We let you guys sleep in today, and we appreciate you spending just a small part of your day with us. My name is Brian Griffin, a marketing assistant here at Messer Financial Group. Many of you are already familiar with Messer Financial, but in case you do not know, we are an FMO located in Mint Hill, North Carolina. We started with just 2 agents, and we are now serving over 20,000 agents across 40 states, and we are still growing. So the longer that you are in this business, the more you realize how important it is to partner with the right carriers, uplines, and or companies. Now, this can make or break your business. The wrong partnerships can slow down your momentum when you're trying to pick it up. The right one can make your business go from bumpy roads to smooth sailing. Now, CSG is one of those strategic partnerships that's actually made things easier for Messer and our agents, providing quote tools that allow our agents to quote on the go with immediate and accurate results. So today, we're going to be speaking with Taylor McDonald. She's been with CSG Actuarial since 2017, and she wears many hats. She manages relationships with prospective and existing clients. She manages marketing campaigns and client accounts, assists in training and onboarding of clients, and she works with us daily to provide support anytime that we do need it. So we're very lucky to have her with us for the next hour or so. But before we do get started, I want to go over the housekeeping rules. So we're going to hold all questions until the end of the presentation. If you have a question, please type it in the box on the right-hand side of your screen, and we'll address it. We'll address your question at the end of the presentation. So now, without any further delay, please welcome Taylor McDonald.
Thank you so much, Brian. I really appreciate that. Today, we're going to be walking through a lot of the different quoting tools that are available through Messer Financial Group's quoting tool. So we're going to start with the Medicare Supplement quoting tool. As you can see on my dashboard, we have all the different products listed out. And to begin a new quote, we're just going to click this Run Quote button under Medicare Supplement. The great thing about the Medicare Supplement tool is not only is it an all-encompassing quoting tool, but it also has enrollment capabilities. So we're going to walk through both of those today. So we're going to run the quote and walk through the quoting functionalities of the Medicare Supplement tool. And we're also going to be walking through the e-application and see how you can actually submit an application directly to the carrier from the quoting tool. Looks like it's just taking a minute to warm up here and to load. You know, many of you may be working from home. I actually am working from home remotely too, so sometimes I think that the home internet can slow us up a little bit. So wait for this to load here. Okay, here we go. So we're going to go ahead and enter a zip code. You can see here, this is where we enter all the quote parameters. So we're going to go ahead and enter a zip. We'll do 28227. We're going to select our age, so we can select anywhere from under 65 all the way to a 99-year-old. We'll go ahead and stick with a 65-year-old. We'll select our gender, our tobacco status, as well as the plan type. So we'll switch this to Plan G for today. We can also choose how we sort the results by. So if we choose to sort by price, we're going to see the results from least expensive to most expensive. We can also choose whether we'd like to sort by AM Best rating or SP rating or company name, which would mean alphabetically. So we'll go ahead and select price. And we can also choose the effective date of the plan. So if we would like to see any future rates, maybe we want to see any rates that go into effect between now and July 1st. Maybe they're not signing up till July 1st. We can go ahead and move that effective date out, and so we can see those future rates in the tool. We can also choose whether we'd like the household discount to be applied. So we can say it's not applied or is applied. And then lastly, we have our client label. So our client label could be our client's name. Maybe we want to say her name is Jane, so we remember who we ran the quote for. And then later, if we would like to do a PDF export of the quote results, it would have Jane's name at the top. So it just keeps it a little bit more professional and organized when you're going through the quote, and later you want to send them an export perhaps. Messer also has this wonderful underwriting filter. So you can see here, once I've entered all my quote parameters, I can either just hit Get Quote and see the results, or if I click Show Advanced, I can actually open up this underwriting filter where I can add in a person's health conditions or their medications they're currently taking. So once I add in a health condition, maybe I would like to choose this person has had a heart attack, and maybe they had a heart attack that was within the last 5 years. We'll select the health condition as well as the occurrence when it happened, and then we want to make sure we hit this add filter. So then you can see the health entry is populated below, and I can actually add in more than one health condition if I'd like, just making sure that I'm hitting add filter below. Same with the medications. Once I've entered everything for the underwriting filter, I can go ahead and hit get quote. And what this underwriting filter does is it will only show us results for carriers that do not have that health condition or medication on their knockout list, so automatic decline list. So we can see here our results are populated. It says carriers listed below accept the following health conditions and or medications. So then of course it says heart attack. So we see our results listed from least expensive to most expensive. We can also take off this underwriting filter. So if we remove this, it's going to show 100% of the results. So you see as I do that, the filter goes away. But if we were to leave that on there, then we would see results only with carriers that would accept that health condition or drug. So again, we see from least expensive to most expensive, we have Aetna at the top here at $96.71. It's our monthly premium, as well as the company name. We can also see the household discount if there is one, and the one-time policy fee if there is one. We also note that there is a parent company name listed, as well as an AM Best rating, the rate type, plan type, S&P rating if there is one, and rating class if there is one. We can also see the years in market and the effective date of the plan. So we can see obviously we ran a quote for 7/1 of 2020, but this plan and this rate went into effect on 12/13 of 2019. On the left-hand side here, you'll notice that we can choose to contract or expand these quotes. They were expanded, but we can contract them to just the price and the company name. We can also click apply discounts, and it will apply that discount. So we notice the 7% discount goes into effect when we select apply discount. We can also choose to see the annual rate, market analytics, and we'll go into these here. So for market analytics, we have 3 different things. We have age increases, and this is for those attained age policies. You can see this is attained age. So this will list for the next few years. So we ran a quote for a 65-year-old. So we're going to see for this particular quote, 66, 67, 68, and 69. So if we were to run it for a 70-year-old, we'd see the next 4 years starting at 70. And what this tells us is right now, what would someone who's 66, 67, 68, or 69 years old pay for this policy? So it gives you a bit of a predictive analysis on how we could anticipate these rates may change or increase over time. So for example, if somebody was 66, they would pay currently $96.71. That's to say that they're paying for 65. So we can see that rates don't jump up based on age for at least a couple of years. And it can vary for different carriers. So it's good to be able to compare that so clients can make an assumption or a predictive analysis on how the rate may increase over time as they age. The increase history is just that. It shows the increases or decreases this rate or this plan has taken over the past several years. So we can see this rate went into effect on 12/13. It was a new rate here, it looks like. So that one is the only one that's listed. But if we scroll down to maybe Oxford Life, we can see back to 2017 how the rate has changed over time. Lastly, we have the market data. So this shows us both on a national and state level, the number of lives that are covered, the premium amount, loss ratio, and market percentage. We do have the opportunity, we have this information for 2018 and 2019, so it always comes out for the year prior. We just loaded in this 2019 data, so you can now use these arrows to compare 2018 to 2019 to see more of that information. If you ever forget what any of these things mean, these age increases, increase history, and market data, and you'd like to know more, you can always scroll down to the left-hand side of the screen and click About Quote, and we get this nice little cheat sheet, I like to call it, and it explains what the age increases, increase history, covered lives, market percentage, premium amount, and loss ratio mean, and also what the source of that data is. So that's a very good place to be able to reference. If you ever need more information or you want to know where this data is coming from, you can check out the About quote under Options on the left-hand side of your screen. We also have the opportunity to include select plans if we would like. So if we select plans, you can see it pulls in those Medicare select plans. And we know it's a select plan because we have this little blue Medicare select indicator here that tells us it's a select plan. We can also remove those, and underwriting filters we already did go over. The application health questions is similar to the underwriting filter where we can add in any health condition that maybe a person has. So we'll select any heart condition here, and we can see that this populates underneath underwriting, and it tells us what the category is, the criteria, as well as the look back period. So meaning on the application, that's where we're pulling this information from, is from the application. So we can see any heart condition, it's not listed on the application. It can vary sometimes, like we see here for Western United Life, their look back period is 2 years. So that means on the application, it's going to ask if the applicant has had any heart condition in the past 2 years. So it gives us a little insight onto how maybe this carrier underwrites and what type of questions are on the application. We also have this carrier resources button. So if we click on carrier resources, it's going to open up the carrier's login page so we can enter the username and password and get into the carrier's website there. And we also have the e-application available. So we're going to get to that in just a moment. We'll actually walk through a live e-application. The last thing I'd like to show you, I'm going to close out these market analytics to make it a little bit easier to see on my screen. We have the compare quote feature. So we have two different options if we'd like to do a PDF. Maybe we want, a client wants to see this entire list and be able to review these and compare their options. Well, we can export this entire quote list by either printing, doing a PDF, or an Excel download of this page. Or if we only want to compare a few options, we can select up to 5 at one time by clicking this red bar, and it will turn green and populate under this compare quote section at the top. So we can select up to 5. So maybe we just want to compare our top 3 least expensive plans. We see they populate under compare quotes. And if I click compare quotes, it's going to show me a side-by-side comparison of just these 3 plans we selected. Again, we can see it says quote comparison for Jane. We said we were running the quote for Jane. And then we can actually just export this page if we'd like. So I'll go ahead and click PDF, a PDF download, and I'll show you how this little export will look. And it just puts them all side by side. So we have our download here, and you can see it would have your agent name, phone number, and email address at the top. We can see it says quote comparison for Jane, and we see the 3 plans side by side. So it makes it really nice and professional to be able to provide your client with a quote like this. And you can also add your picture if you'd like to have your picture on the export. So we'll go ahead and go back to the full results here. And we're going to walk into the e-application. So this is a great new feature we rolled out recently. It was last year we rolled out with this. And you're actually able to submit an application directly to the carrier from the quoting tool. So no having to go to the carrier's website or sign into another system. It can all be done right on this platform. So in order to do that, you would just click this Apply Now button under whichever plan you'd like to submit or start the e-application for. I'm going to move over to my staging environment, which is because I'm not a licensed agent. I don't want to actually submit an application. So we're going to move to this demo one over here. It's going to look the exact same. I'm just going to quickly run a Medicare Supplement quote. This is just my testing or demo environment that I can show you for training purposes, that I can actually submit an application. You can see how it works. So again, we just run a Medicare Supplement quote. It's going to look very similar to the MESSER quoting tool. And I'm going to go ahead and find this Apply Now button. So to start the new e-app, we'll just click Apply Now. And it's going to take me directly into the application. So it doesn't open a new window, it doesn't go to the carrier's website. It's going to take me right into the application. So here we are. So today I'm going to be David, and I have my producer number. So the first time you're doing an e-app for a particular carrier, in a particular state, you will need to enter your first and last name as well as your producer number to validate that you're licensed with this carrier. Obviously, in this case, it already populated for me, so I've done an application in Nebraska for United World Life in my staging environment, so it remembered me. So it's really nice. It can remember you when you come back. You don't need to enter that every time. You can see it pulled over the quote credentials. You can see I've got a Plan G, what the price is, and I'm still a female age 65 client here. We can download any initial documents we'd like from the e-app. So maybe we need to get an outline of coverage or guide to insurance. Any of those options, we can get them right here from the beginning. We would start by selecting our underwriting type and everything here. You can see on the right-hand side, this is our underwriting situation, and we're going to move through the app. So this is how you would start a new application, and that's how you would move through the e-app. I'm going to now show you how you would go to an e-app that you've already started. So maybe we started this brand new e-app, we got about halfway through, and for some reason, maybe our client had to run, or we were going to finish this later. It will save as we go. So each time you hit continue in each of these sections, it's saving for you. So you can go back into the application at any time and continue, which makes it nice. You don't have to finish it in one setting if that's not feasible for you. So if we go back to the dashboard, I'll show you how to get into an application you've already started or already submitted. So from the dashboard under e-applications, we're going to click View Active, and we're going to go into an application I've already started, so we are a little bit of a head start here. So this is my applications dashboard. Any applications you've already started or submitted will be listed here. You can see that some of these have different statuses. So incomplete, this is the one I just started. So we know that obviously it's not completed yet. I have some that are consented to, meaning that we have the signature from the applicant, or one that may be failed if I had a reason that it was not able to submit, or a submitted policy here when we have that policy number available. So those are a few of the different things you may see in the application dashboard. So I'm going to go into this MESSER test. This is what I just started previously today, and I got some of the application filled out, so we're not having to fill out every single section as we go through this together. So again, we hopped right into the application. You can see on the right-hand side, it saved everything I've done previously. We have green check marks, so that means it's good and it's filled out. So again, moving through the application, you would select your underwriting type and your plan eligibility, including your date of birth and Medicare Part A and Part B effective dates. You'll notice I click continue to move to each of the sections. Again, it's going to save as I go. As I click continue, it saves that section, so we don't have to worry if something would get lost or we got disconnected, maybe our internet or something went funny. It's going to save as you go. Applicant information, we can choose how we heard about this carrier, our plan type, and you'll notice if I were to change maybe from a Plan G to a Plan N, it will actually update this price for me as I go. So I might have to move to the next section before it updates for me. Sometimes it takes that hitting that continue button to update, but anything we change in this application is going to update it in real time. So maybe if I had a different effective date and that changed the price, everything will update as you go. So it makes it really nice and really foolproof as you're going through it, that you know everything's going to be correct for your applicant at the end. This is the applicant email address. We always want to double check that because that's how we would do the e-signature process. It'd be sent to the applicant email. So we really want to make sure we enter that email correctly. This is all that applicant information, their date of birth, their gender, height and weight. It's going to ask us about tobacco status, if we'd like explanation of benefits, if we'd like a temporary Medicare Supplement ID card. So all those basic questions. We can hit continue, or we can just click the next section and move forward. We have a couple different options. If maybe I just need to jump ahead to a section, I don't want to scroll all the way through, I can just select the section I'd like to move to. Household premium discount, it's going to ask if we are eligible for a household discount, we'd like to apply, and it will also list out that household definition for us. And I'm going to say no, that we're not going to do the household discount today, but it will break down that definition based on the carrier so you know if they'd be eligible for that. We have our Medicare information. It's going to remember this from previously on that first section where we entered our eligibility dates. It pulls all that over for us. And it's going to ask us for applying during open enrollment period. So maybe if I selected full underwriting, but I did turn 65 in the last 6 months, it will actually tell me that I'm actually eligible for open enrollment, or I'm during an open enrollment period, and to go back and change my underwriting type. So it's going to catch those things as well, again, making it very foolproof for the agent that they know they can't really mess up anything on the application. They can't select the wrong underwriting type. It will catch those things. This is our previous or existing coverage information. So it's asking if we are covered for medical assistance, if we have another MESSER Medicare Select policy in force, any Medicare plans other than Part A or Part B, and if we've had coverage under any other health insurance plan in the past 63 days. So all those questions, pretty self-explanatory. We'll keep moving through. And as far as the application being a real-time smart e-app, the same would go if we were doing a full underwriting application. So in the full underwriting, it would ask obviously about any drugs or health conditions we have. If we enter a drug that would be a declinable drug, maybe we enter something where it's an automatic decline, we would actually get a notification up here that would tell us that we cannot submit the application because we've entered a declinable drug. So that also makes it, makes the agent and the applicant aware, so they're not going through a whole application, selecting a drug, submitting the app, and waiting to hear back that it failed. So it will actually tell them right away, hey, this drug you entered is a declinable drug, so that you're not wasting your time submitting apps that are going to be automatically rejected because of a certain drug we entered. So that's a very good thing to know and a big time saver as you enter any drugs or health conditions, that it all underwrites in real time. This is our method of payment. So if we do a wet signature option, which usually for the e-app would not be the case, but it is an option, we could do a check. But otherwise, if we're doing the e-signature, we can choose bank account withdraw, our account type, routing number, and account number, so that we can automatically withdraw that money from our bank account. And we can choose what day we actually want this to be withdrawn on as well. So I said first of the month. And just like that, we're already almost through this e-application. So it's a very quick, easy process. This part's to be completed by the producer. We choose where we'd like the application delivered. We say we've accurately recorded the information, and we interviewed our proposed applicant. And we can also add any notes to underwriting. Lastly, we can choose if we'd like to upload a certain document, such as notice of termination or evidence of insurance. And we can choose those files from our computer and upload them right to the e-app, so they're submitted right to the carrier. Once we've uploaded any documents we'd like to, we will go ahead and verify this application. And then we're just looking at this application. We're making sure all these sections say complete. If we missed a section or missed something and left it blank, we'll have a yellow incomplete notice here, and we would know to go back and edit that section to add that information that's missing. So we're just double checking everything here. If maybe we miskeyed their social security number or their birth date, something, we can just click edit section. It will take us right to that section so we can correct those things. But otherwise, everything looks great. We've got our green check marks all the way down. Everything seems to be filled out. We're going to go ahead, lock and e-sign. So we could print for signature if we wanted wet sign, but again, we're going to do the e-sign. So we're going to lock and e-sign. And what this is doing is it's locking the applicant's information in here. So if we needed to, we could go back and still edit something, but in that case, it would notify the applicant. So that way we know the agent's not changing the information that the applicant has provided. We're going to go ahead and read the terms and conditions for the e-signature. Make sure we read those thoroughly. And then we're going to go ahead and agree. And then this is our statement of signature. So this is how we choose how we're going to sign. So if we are in the same physical location, so someday as maybe we get back out and we're starting to meet face-to-face with these clients, we can say, yes, we are in the same physical location. And then if they're sitting here with us, all we need to do to sign is provide the applicant's maiden name and last four of their social, and that actually counts as a signature. So they don't even need to do any sort of email signature or anything if they're in the same location as us, sitting here with us doing the application. But most likely, if they're not in the same physical location as us, we will select no, and then we can do the email signature link. So then it would send an email to the applicant's email address. So you can see it's my email here. So we want to double check that. If for some reason it's incorrect or we notice we mistyped, we would want to go back and edit that. in the application section, we're asked for the email. And today I'm going to pretend that we're in the same physical location just so that we don't have to go to my email and retrieve the email. But I'll explain how it would work to do an email signature. Once we hit apply e-signature, or we would sign this, if we did the email signature option, it's going to send an email to this email address, so the applicant email address. And it's a very simple email. It has two things, a link and a verification code. All they need to do to sign is click on the link and enter the verification code. So it's very, very, very easy for the applicant. They just look for that email. The email is very, very obvious about what it is. It says, we're awaiting your signature for United World Life Insurance Company application. Please click the link below and you'll enter your verification code. So it's very easy. It's not confusing at all for them. They get the email, they click the link, and they enter their verification code. So again, I'm going to enter the mother's maiden name just for demo purposes today. We'll want to make sure we open up all these different documents here. We make sure we read them. They're all opening here. I just clicked them open at the top of my page. We say that we read, received, and kept a copy of the documents, and then we'll put our mother's maiden name and last four of the SOCH. We'll say that we're signing in Omaha, Nebraska, just saying what city and state we're in, and then we'll apply the e-signature. And then the producer will put their first and last name and producer number, which will auto-populate, and then we'll apply the e-signature, and we'll go ahead and sign the application. Okay, so after we hit that we're signing, this is actually submitting the application now to the carrier. We have one last chance to print or save a copy of these documents. I'm going to close over the top. So I'll click on the application. I'll show you how this would look here. We actually would get an actual PDF application, and it's filled out with everything we enter on the e-app. So really good if you ever need to pull that PDF application. It actually filled it out the whole time we were going through it. So it's really nice to have that. So I just want to show you how that looks. It's still submitting the application here. Again, we're in a testing environment, so it's not really going to submit to the carrier, but showing exactly how it would work. We'd want to make sure to download all these documents here and make sure we save those. You will be able to go back into your e-applications in the e-application dashboard and download the PDF application at any time. So that's good to know if you ever need to go back, or keeps it saved there for you. And then once it's been submitted, it says thank you for submitting a Medicare Supplement application to Mutual of Omaha Insurance Companies. Please reference policy number right here. We get that policy number immediately. So really nice to have that as well for your records, and that will also be in the e-application dashboard as I showed you before. So that's the e-application. I'm going to go ahead and take us back to MESSER's tool here. So we've covered Medicare Supplement quoting. We've covered the Medicare Supplement e-application. And I'm going to take us back to the dashboard here, and we're going to go ahead and we're going to walk through, close out this tab. We're going to walk through our final expense tool next. I'm just going back to the dashboard. Okay, final expense, it's the same as Medicare Supplement. Where to start a new quote, we're just going to click Run Quote. We'll enter our zip code, 28227. We'll choose our age. So this one we can go anywhere from 0 to 99. Our gender, tobacco status, and face value or monthly rate. So you can choose the face value of your plan, enter anything you like, or you can choose a monthly rate. So maybe somebody says, well, I only want to spend maybe $30 a month. I only want to spend $30, don't want to pay anything more. We can choose a monthly rate, and then it will show us only plans that would be under that $30 price range. So it's really nice to have two options, face value or a monthly rate. We'll go with face value today. So we'll leave that at 10,000. We can choose our product type. So graded, level, 20 or 30 pay, modified or ROP, the 3, 5, 7, 10, or 15 pay, and single pay. We can also choose the underwriting type, full or guaranteed, and how we'd like to sort the results by. So price or AM Best rating or S&P rating. Again, we can add a client label if we like we did before. We said it was for Jane, so then we do a PDF that has her name on it. Once we've entered everything, we'll go ahead and hit Get Quote. And again, we're going to see these final expense results listed by price, so least expensive to most expensive, and we're going to see them all listed similarly to the Medicare Supplement tool. So nice thing is with using this tool is once you get the hang of one product line, it makes it really easy to run quotes in any other product line as well, because they all function very similarly. Okay, so we've got our results here listed by least, or least expensive to most expensive. So we've got our top one here is $37.81. It's United of Omaha Life. We see that monthly premium, again, the carrier name, as well as the one-time annual fee, what the plan is, the AM Best rating, parent company, S&P rating, years in market, and underwriting type. Again, we can expand or contract these quotes. We can apply the fee and see what the monthly premium would be with that fee applied. We can also choose if we want to see the monthly rate, or we can switch to quarterly, semi-annual, or annual. So a few different options of how to view those prices. We can go into the plan details here, and it will pull up our final expense plan details for this particular plan. I'll open this up here. And it's just taking a second to load here. Okay, so we have our United of Omaha Life Insurance Company. It shows us the annual fee, all these rates here that we listed out, we went over. It shows who the parent company is, the plan, underwriting type, what query we ran, and the company details here. So it's just going to list it out, the single plan, singly by itself. We can also do the compare quote that we showed you for Medicare Supplement, where you select up to 5 carriers at a time, or 5 plans at a time, and you can compare them side by side. Again, we can do the PDF download as we showed you for Medicare Supplement. So there's always a few options of how you'd like to display this information to your client, or just for your own use as well. I hit back. We're going to go back here to the full final expense life list. But again, we can always do a PDF from just this page. So if we just want this one plan in a PDF, and they want all the details, we can hit that PDF button, or we can do we can print from this page too. Okay, so we're back to our full list here. Again, we can do the compare quotes as we mentioned, where we just click compare quotes. We also have a feature that I want to touch on. It's called universal compare. So the compare quotes, where we select these bars and they turn green, and we compare 3, 4, 5, however many plans up to 5 that we would like side by side. That's a compare quote. So maybe 3 Medicare Supplement quotes or 3 final expense quotes, the same product side by side. That's a compare quote. The universal compare is if we want to compare plan details of up to 5 multiple quotes that are different products. So maybe we want to compare a final expense plan, and we want to see it next to a dental plan. Well, to do that, instead of clicking this entire bar and turning it green, you click this tiny globe here on the right-hand side. It says Universal Compare, and it will turn purple. So I'm going to save this United of Omaha Life plan. By clicking this Universal Compare, it populates under Universal Compare. And now we're going to go ahead and move to a different product. We're going to quote, we'll quote a dental plan next. And I'll show you how you can actually compare 2 different products side by side. Really similar to the compare quote, but it's 2 different products, or 3 different products, all the way up to 5. So again, for dental, it's the same as the other products, where we enter the zip code, age, gender, tobacco status, and how we'd like to sort the results by, price, AM Best rating, or S&P rating. We can choose if we want to see dental plans, vision plans, both, or if we just want to choose one or the other. And we can also choose covered members. So individual, individual and spouse, individual and children, or individual and family. So we'll go ahead and do an individual dental quote here. And we'll see, once we see the results on this next page, that we still have that final expense plan that we saved under Universal Compare. It's going to populate automatically for us in that upper left-hand corner. So you can compare that final expense plan to whatever dental plan we select. And it will stay there until we click the X out of it. So here it is. we have our universal compare, and we have our United of Omaha Life Insurance Company final expense plan. So that's saved up there for us. And now we can see our list of dental plans listed by least expensive to most expensive. We've got our premium amount, company name, the base plan. We can, again, go into the plan details. We can click carrier resources to go to the carrier's website. And if I select universal compare, now you can see I have both of my plans here, final expense and dental. And if I click on universal compare, it's going to show me these two plans side by side. So we have a final expense plan compared to a dental plan. We can do this with any 2 products, up to 5 products, because you can have 5 listed at one time. Again, you can do a PDF of this. So we have 2 different products here. We can do a PDF download and provide this to our client. We can print this. I'm going to take us back here. But it shows all of those details. And for the dental, we can actually choose the benefit amount, which I'll show you here. So I'm going to X out of these. I'm going to go into my dental plan. I'm going to choose this emeritus plan here. And as I scroll down, so we see this is a $10.67 plan. If I change the benefit amount, and in this case you cannot because it's just one base, it's a this 130 maximum benefit amount. But if it has different benefit options and we change these, if it's a drop down, you can actually see how it would adjust the price. So on some of these plans, you can actually change that, and it will actually it will increase the premium amount for you. Just as it says here, a higher maximum benefit amount will increase the premium amount. So if we have a choice, we want to choose to change that benefit amount, it will show us how the price would be reflected. So that's good to know for the dental plans. The last quoting tool we're going to go over, actually we have 2 more. I was just kidding. We still have hospital indemnity too. So we're going to go back to the dashboard. We'll go into the hospital indemnity quoting tool. Again, we'll just click run quote. 28227. We'll choose our age, our gender, and tobacco status as we do for the other products. We can choose how to sort the results. We'll hit get quote. So by now you should be seeing that there's a lot of similarities on how to run the quote. So it makes it really easy once you figure one out to do the next. So we have our results listed by price, the cheapest to most expensive again. We have our carrier name listed, our premium amount, base plan, the household discount, policy fee, everything's listed here. We can go into our plan details. We can click carrier resources. If we have a PDF application loaded in here, you can also download that from this page. We can choose to expand or contract these quotes. We can do the compare quotes. So all the functionality is still there, just a different product, but all the information's there. We can go into plan details. We can sort if we want to only see plans containing household discounts, and we include the filters. So if we know we want one with a household discount, we can sort that way on the left-hand side. We can take that off again. So we have everything, all the information's there. If we go into plan details again for the hospital indemnity, we scroll down, I'll show you how we can change that benefit amount. So $3.19, maybe we change it to $550 a day. So now it increases the price to $35.14. So this is a good example of how you can change the benefit amount, and it'll actually change the premium amount and show us what the premium amount would be. So we can actually play around with that and see how different benefit amounts adjust the premium. Same goes for, all of these. We can choose different benefit amounts for emergency room, hospital outpatient, lump sum, hospital confinement benefits. So we can actually build the hospital indemnity plan we want by selecting those different plans, those different benefit amounts, and seeing how it would affect the pricing for that plan. Again, we can do a PDF or print this page, so all very similar to the other products that we walked through today. Now we're finally to our last quoting tool. So our last one we're going to go through is the PDP. So I'm going to go back to our dashboard to get there. So in order to do a PDP, we will click Run Quote. We will enter our zip code, 28227. We will choose our plan. So we're going to go ahead and select Part D. We can choose to filter these by enhanced, basic, or low income subsidy. If we do low income subsidy, then we can actually select the percentage. So what the subsidy level is. This is a new feature we just rolled out the past couple weeks. So that's a great way to be able to filter, or we can just select all. We can choose the effective year, how we want to sort the results by, and again, we can add that client label if we'd like to. So again, we're going to see our results here for our PDP, our Medicare Part D here. Okay, so you can see these plans listed by the premium amount and carrier name. Again, like we always can see, we also see the deductible amount. We can choose to see annual rate, market analytics here. We'll go through these. The county penetration and company enrollment. So the county penetration shows we have 2 counties here. So this zip code falls in 2 counties, Mecklenburg or Union. So if we just select one, it will only show one. But it's showing us for the past couple of months in this year, what was the number of people that were eligible for a Medicare supplement, or pardon me, a Medicare Part D plan, and the number that were enrolled, and then what the penetration is. So that's good to see. And then for this particular company, how many people are enrolled, and then what the penetration is. So we can compare that. Again, if we ever get confused, we would tell this about quote here, and it shows us, for this one, it shows us how to do the compare quotes and universal compare. So we also have the carrier resources button. So if we click carrier resources, it will take us to that carrier's website, so we can get signed into their website, see anything that we need to see here. So it links you right up to it. Again, we can do the compare quotes by selecting up to 5 plans at once and comparing them. We can adjust our low income subsidy level. So we can adjust these here on the left-hand side as well. So very interactive tool, makes it really easy to compare all of your options here. No matter what the product is, you can compare it here on the quoting tool. And again, we went through just to recap, we went through the Medicare Supplement quoting tool. The Medicare Supplement quoting tool also includes Medicare Supplement e-applications, which we walked through. We also went through the final expense quoting tool, dental and hospital indemnity, and then we just finished up here with our Part D quoting tool as well. The last thing I will show you is if you would like to put your picture on your PDF printout or your PDF download. In order to do that, you'll just go up here to the left-hand corner of your screen and you'll click on your username. So if I click on this, this is where I can update my account information. So my first and last name, if I ever needed to change that or update that, I can always do so. My phone number, maybe that changes, we can update our phone number. And then this is where we can choose that picture. So we would just click choose file, and you can upload the picture of yourself if you want that to be on the printout. And then you can put your agency name or your website, so that can all be on your printout as well when you give it to a client. So that pretty much covers everything I have to go over today. I'll go ahead and pass it back over to Brian.
Absolutely. Thank you so much, Taylor. That was a ton of information, and I just want to let everyone know this information, it is going to be posted on our website in the Learning Center. So you can go through this, you can look at it and go through the steps that Taylor just went through with us again. One thing about the e-app, and I kind of wanted to bring this up concerning the e-app capability, MESSER, we will have to turn on the enrollment for each agent. And you'll only have access to do the e-app if you are appointed with that carrier, with MESSER. If you are interested in this, you can actually email us at MESSER or at mfgmarketing@messerfinancial.com. That's mfgmarketing@messerfinancial.com, and I'll have that information in the email that I send out to you. We just need to verify your contracts and then turn them on. So I just wanted to make sure that I was clear with that. So we do have some questions, Taylor, if you don't mind. If you can answer a few of the questions, that'd be great.
Sure thing.
All right. And actually, let's see here. Actually, I answered some questions on the back end here. It says, so the first question here from Kristen says, drugs can be looked up in the quote before starting app. So would we know before taking the app if it was a decline? Is that correct or no?
That's a great question. So for the Part D quoting tool, currently what you would do is you would have to enter that in on the carrier's website after running the quote. So you would have to go to that carrier information button which I know is not the answer you're looking for. However, great news here. We have it slated for Q3 of this year to be releasing the drug lookups. So that is something that we're working on. So although we cannot enter those drugs prior to the quote, that's a new enhancement that I was notified of last Friday, and we're all very excited about it. That will be coming soon. So you will be able to do that. But currently, you cannot enter the drug in before. You would have to go to that carrier's website to add in those drugs.
So as far as the and just for clarity, so like for example, when you initiated the Medicare Supplement quote and you went into show it enhanced, and you there was an opportunity to put in some underwriting and then also the drugs. I'm not sure if that's what she's talking about or not.
Yeah, so for Medicare Supplement, you can enter those drugs and health conditions before running the quote. You cannot do that for the Part D currently. That's not a feature that we have, but it will be coming in Q3. So right now, if you wanted to add any drugs for Part D, you would have to run the quote first, just normally run the quote, and then click carrier resources and go to that carrier's website. So it wouldn't actually be a feature of the tool to add that in before.
I got you.
It is coming soon.
For the drug. Okay. So the next question here is, it says, what carriers accept this e-app?
Do you want me to go ahead and touch on those that are offered? I don't want to speak on for any that would not be on your quote.
Yeah, so I'm going to assume if it is available, you will see that it's available. Would that be correct?
Yeah, and we have that apply now button
Yeah.
under each of those that would have it available. If you want, after the call, Brian, I can send you over the list of the ones that are activated here on your tool that are live.
Hey, let me step in real quick, Brian. I think this is Chris Middleton with MESSER. I think what we have available now is all the Aetna products, so Aetna and Extend, GTL and Mutual Omaha. I think those are the only carriers that they have available at this time.
All right, thank you, Chris.
But we'll send it out with an email to confirm those, though. Sorry.
Excellent. No, thank you.
No problem.
All right, so and now Tanya's question is about MedSup quote. Can you enter medications under underwriting? You just touched on this. If so, where can you enter the medications?
Yeah, great question. I can show a quick example of that too. It's right here. So when you're running the Medicare Supplement quote, so you'd enter in, where you enter your zip code and everything, and you can choose your plan. And then underneath here where it says show advanced, this is the Medicare Supplement underwriting filter. So you'd click show advanced, and this is where that drops down. So this is where you add in their health conditions. So let's say we want to do any heart disease, and we'll say that it happened less than 2 years ago. We'll click add filter, and you can also choose medications here. So you can see there's a huge list of all medications. You can search for medications, you can scroll through. So maybe we choose this one here, and we say, whatever their conditions would be, you can select any medication possible. They're all loaded in here pretty much. And then we'd hit add filter, and that's how you'd add in medications. So you can add in as many as they're on, both for health conditions and medications. And then we hit get quote. It will only show results for carriers that would not automatically decline based on those health conditions or medications. So it's that little show advanced button under the Medicare Supplement quote. Does that help answer the question there?
Absolutely. That's really going to help our agents pinpoint exactly what they need as far as the results of their search. So I appreciate that. So a few more questions here. All right. So Jerry asks, will carriers who offer phone voice signature be available through this tool?
For the e-application, I'm assuming, so he's asking.
Yes, ma'am.
Okay, so currently for the e-application, it is just the email signature, or if they're in the same location, the mother's maiden name and last for the SOCH. we've talked a lot about other signature methods. And so as our e-app keeps developing and keeps growing, we hope to offer additional signature methods. But right now, it would just be the email signature that's available.
All right, thank you for that. And then on final expense, Christine asks, what does annual fee mean?
So the annual fee would be the carrier's fee. It's a one-time fee usually when they would sign up for that plan initially. It can vary a little bit by carrier to carrier, but it's a one-time fee that they would just pay for that policy.
Okay. All right. And are you able to compare? One second here. I apologize. Paul is asking, with the drug lookup that you're talking about, will it be shown in the comparison like it is under quoting? And Paul,
that's a great question.
Go ahead.
I was just going to say that's a great question. I was just discussing this week with our director of product implementation about how this is going to look. I don't really have a clear answer on exactly how that will work yet. I know they're shooting for September, and so that's only a few months away. But I have still not seen how it's exactly going to look. So I'm not quite sure that I have a clear answer on that yet. But as we have a way to show you how it's going to look, and as I start building that, we'll be sure to pass that along. But right now, I don't have a clear answer on exactly how it's going to work functionally or what it will look like.
Okay, thank you. Thank you for that. And one of the things I want to clear up, so MESSER, so this tool is something that is available. So to all of you that are attending today, this tool is something that is available through messerfinancial.com, through our website. It's one of the quote tools available through that. We do have an additional tool that is available to our agents, which is My MFG. So these are two completely separate tools. So I think some folks are getting them mixed up, but these are two completely separate tools that are available to you. So I just want to make sure that everyone does understand that. At this time, and I appreciate the time that you've taken to go through this, Taylor. Before we do close out, is there anything in closing that you want to share with the attendees?
I don't think so at this time, just that, as they ever come up with any questions or they, have any questions about the tool or any functionality, just to be sure to either, pass those along to yourself or to me, that, we're always here to help agents be successful in using this software. So as any questions always come up, please just be sure to pass those along, because I'm always for sure happy to help with anything.
Yeah, and one of the things that I do want to let everyone know, and once again, I appreciate you going through this. This is a tool that MESSER does provide to our agents at no cost. So this is something that you really just have to go into MESSER Financial under Agent Resources and Quote Tools. You're going to select the second one down, and then you're going to register for the tool. So this is something that is free to our agents. So just keep that in mind, guys. Once again, I want to thank Taylor for taking this time out of her day to go through this process. And just so you all know, once again, this is being recorded. It is going to be put up within the next 48 hours on under our learning tool at messerfinancial.com. So if you have any questions or you think that you may have missed something, go ahead and you can rewatch this. But once again, I want to thank all of you for taking time out of your day. Hopefully you learned something that's going to help you grow your brand and your business. If you are not contracted with MESSER and you have questions about partnering with MESSER Financial, feel free to contact our marketing department at 866-568-9649, extension 7819. This is just one of the tools that we have available to our agents. We want to make sure that we're investing in your success. So make sure that you do take advantage of this. If you also have a moment, go to our events calendar at messerfinancial.com. We will be having webinar workshops scheduled throughout the year with valuable information, just like Taylor shared with us. And once again, I want to thank you all so much for joining us. Please take care of yourselves and everyone around you. Have a great day.